Hi, I'm Jo from Specialist Language Courses. We are OET Premium Preparation Providers, which means we are experienced and skilled in what we do, helping people achieve success in the OET exam. So in today's video, we're going to look at OET speaking and how to approach the test. We will look at what happens in the speaking test, how you are assessed, the role cards, and how you should approach the test. So what happens in the OET speaking test? How long is the speaking test? Well, the test lasts about 20 minutes. The first 3 to 4 minutes is the warm-up section, which is not assessed. Here, the interlocutor will ask you a few questions about yourself and your profession. Then, you will perform 2 role plays, which last about 5 minutes each. And you will have 2 to 3 minutes before each role play to prepare. What do you need to do? You will play the role of the healthcare professional, so a doctor or nurse. It will be during a consultation, and the interlocutor will take the role of the patient, or in some cases, a relative or carer. You will need to ask questions and provide information depending on what is written on your role card. How will you be assessed in the speaking test? So, your English will be assessed on 2 sets of criteria. The first is the linguistic criteria, and this assesses you on areas such as pronunciation, fluency, and language. And the second set of criteria is the clinical communication criteria, and this includes things such as relationship building, exploring the patient's concerns, and providing information. So what's on the role card? Well, on the role card, there are several pieces of information. The setting, for example, a hospital ward, a little information about the patient and the current situation, and then what you have to do during the role play in the form of tasks to complete. Common tasks are find out, reassure, explain, suggest, but there are many different types of tasks that you could be asked to do. How should you approach the role play? Well, let's first look about what we can do in the preparation time. During the 3 minutes preparation time, it's important to read the role card carefully and find out who you are, who the patient is, what the medical issue is, and think about how the patient is feeling, for example, anxious or frustrated. A good tip is to underline all the key verbs in the tasks and then think of useful phrases and vocabulary that you will need for each of them. Also think about how the conversation might flow. For example, you might find out information about lifestyle first before suggesting some changes. So what should you do in the role play? So in the role play, you should be ready to start the interaction. For example, "Hi, my name's Jo. I'm the nurse on duty today. I understand your son was brought in with a bad flare-up of his eczema. Is that right?" Use the information on the role card to guide you. Listen carefully to the patient and respond appropriately. For example, if they say they are worried or anxious about something, empathize with them by saying something like, "It's understandable that you're worried." Be confident and behave as if you would in a real-life work situation. Remember, you are a nurse or a doctor and you know what to do. Top tips for OET speaking. Use the preparation time to analyze the role card and predict the flow. Be ready to start. Listen to the patient and be ready to adapt. So thanks for watching. If you'd like more tips and strategies on how to prepare for the OET exam, check out our website, link below. Please like and share so we can help more people achieve success in the OET exam. Don't forget to subscribe for more videos like this. Bye!